Have you heard of the concept of therapeutic gardens or healing gardens? There are many projects called healing gardens that have very few components that are restorative and very little understanding of human psychology. Today I want to share with you what a healing garden is and what are the keys that it must have in order to really have a positive impact on our health. My name is Albert Severa, founder of Simbiotia, and I'm specialized in humanizing and transforming care centers. In fact, the idea of the therapeutic garden is nothing new. All the old healthcare centers already had a garden. As a very important element of the healthcare center, the first references to gardens as part of rehabilitation therapy come from ancient Egypt. And as early as the Middle Ages, the garden was used as an important element in the recovery process, and this would continue well into the 20th century. During the 19th and 20th centuries, sanatoriums for the mentally ill began to use gardening and agriculture as part of their therapy, with very successful results. The use of wheeled beds was introduced in tuberculosis sanatoriums in the late 19th and early 20th centuries so that patients could go outside and enjoy the benefits of fresh air and sunbathing. There was a very important change between 1950 and 1990 with the advance of medicine, the discovery of antibiotics and technological advances. Contact with nature became less important and the focus shifted to creating buildings to reduce the risk of infection and to effectively house technology. The construction of hospital buildings was more like that of an office tower, with artificial light and ventilation and no contact with the outside. The result was places that did not take into account the needs of both patients and healthcare staff and generated very high stress on them. It was only recently that scientists began to see that it might have been a mistake to suppress contact with nature. Beginning in the 1990s, a movement known as patient-centered care began in the United States, where the administrations realize how negative this type of environment is. And they are starting to change and start creating environments that are kinder to both patients and healthcare personnel. And the healing garden is one of the many works that can be done to transform healthcare. A therapeutic garden is not just about putting a garden in a hospital or nursing home. A healing garden has elements that are technically and strategically arranged to meet specific therapeutic objectives. It is an outdoor space designed to meet the physical, psychological, social, and spiritual needs of any person in a healthcare facility. It should be a place to help them maintain contact with reality and provide them with psychophysical well-being for the patients' companions, and also for the health personnel. To define a healing garden, we rely on three fundamental principles. The first is biophilia, which biologist Edward Wilson of Harvard University defined as our innate connection to nature. The second is that of psychologist Kaplan, who defined the impact of involuntary attention on mental fatigue. And the third was Robert Ulrich's stress reduction studies. Within this topic of healing gardens, there are several types. Let's talk a little about them. The first one is the rehabilitation garden. The main objective is to avoid this type of gymnasiums that are in a subway space without light, to take the patient out to an outdoor space with all the benefits that are here. It is a question of defining physical challenges that allow the development of the muscle functions that they give. For example, we can define a type of pavement with a specific slope which, according to the criteria given to us by the physiotherapist, allows us to develop a type of musculature that will benefit us for the type of therapy we are going to perform. The second is the stimulation garden, whose main objective is to stimulate the senses in some areas and brain processes. In these environments, we encourage exploration and recognition of the environment, inducing sensory awakening and promoting neurodevelopment. We induce processes that interact with the senses, both with the primary senses such as sight, smell, hearing, and touch, but also with the secondary senses, such as the acceptive and vestibular senses, but also with other neurological processes such as memory. There is something called snow cell and wings, which are an artificial way of being able to generate these kinds of targets. In the stimulation garden, we can achieve these same benefits, but in a much gentler way for patients. This makes it much easier to work with autistic children or elderly people suffering from asphyxia. The third is the habilitation garden, which aims to develop patients' maximum independence through gardening and therapeutic horticulture. They are particularly suitable for people in a situation of dependency or with certain levels of intellectual disability. The fourth is the restorative garden, or also known as cancer garden. They are a context of emotional and physical refuge, especially suitable for acute care and psychiatric hospitals. They include areas for relaxation and contemplation as well as spaces for exercise. They are also beneficial for both patient companions and staff. And the fifth is the contemplative garden, which is very appropriate for treating certain mood disorders, such as anxiety, stress, burnout, or bereavement. There are many aspects to consider in both the formulation and design of the space, but I will summarize some important elements. As I mentioned before, in oncology centers, we have to be very careful with the use of aromas, both in the plants we use and also in the location of the space. For example, we cannot put it next to a kitchen or next to a cafeteria, since these aromas that are emitted would influence in generating nausea in people who are receiving chemotherapy treatment. Or for example, in people suffering from Alzheimer's disease or other mental illnesses, it is necessary to generate safe routes. For example, the entrance and exit are the same, due to their loss of perception of space-time, introducing also elements both vegetal and material that encourage them to activate and recover part of their memory. In the specific case of HIV patients, we must be very careful and generate many shadows, because due to the type of medication they take, we must be very careful to the exposure they have to the person. I recommend creating spaces that favor socialization and in places where there can be a certain degree of privacy. These spaces can also be used to change the doctor-patient relationship into a friendlier environment, including the relationship with the patient's companions. Obviously, the place has to be fully accessible. Special emphasis must be placed on the level of comfort of the people, since patients are in a situation of vulnerability and generally with reduced mobility. Handrails must be provided, seats closely spaced along the route, non-glare flooring due to the sensitivity generated by certain drugs, benches with armrests, and even elements that allow people to lie down. It is not necessary to have the idea that a therapeutic garden cures the person. The purpose is to provide relief. Psychological discomfort caused by an illness. I can assure you that the benefits are not few. Here are some of them. Stress reduction, helping the body to find its balance. Reduction of pain perception, reduction of depression, improved quality of life for the chronically or terminally ill. Helps the patient to evoke his or her own healing resources. Creates a suitable environment for the patient to perform physical therapies. Improves the quality of life of healthcare personnel by providing places of disconnection. The consequences this has in an improvement of the service, decrease in hospitalization time and the use of painkillers. Create a much friendlier space for patients' companions to wait, and also a much more pleasant place for a doctor-patient relationship. The process is almost more important than the design itself. A healing garden is not just about design or landscaping. It is about initiating a process of transformation of the organization that will be a before and after. It is a change in its DNA. It is about initiating a deep process of co-creation and participation. On the one hand, with healthcare personnel, nurses, doctors, physiotherapists, psychologists, and on the other hand, a whole design team working together to create spaces centered on patients, patients' companions, and to meet the specific needs of healthcare personnel. It is very important to incorporate all the scientific evidence on this subject into the project. As I was saying, this is a process of humanization of the organization where the objective is always to put the patient at the center. A healing garden is highly recommended for hospitals, nursing homes, mental health centers, cancer centers, rehabilitation centers, addiction treatment centers. Although they can be used in many places, both in companies and public parks as well as in private residences, even on the facades of community buildings. As a consequence of the health crisis that we are experiencing in the 20th century, it is an opportunity to rethink a healthcare centered on the person, more humane and dignifying the lives of patients, health personnel, and those accompanying patients. The actions that we take today in this direction will shape the healthcare of tomorrow.